Good morning, ladies and gentlemen. Good morning, ladies and gentlemen. Avusheni Machelo. Are you ready for what's going to happen this morning? Wonderful. You're looking so fabulous. I've never seen you so well dressed in my life. Congratulations, graduates. Ladies and gentlemen, I've got a few announcements, a few ground rules that I want to share with you. The first one is in terms of the Protection of Information Act, the fact that you attended our graduations this morning, it means you have given the university permission to take photographs. And the photographs that will be taken this morning will be used for the newsletter, publications, social media of the university. So don't be surprised when people come and take photographs. It is solely for that purpose. The next announcement is that kids under the age of 7, please bear with us, are not allowed to be joining you in these proceedings. You are also requested to switch off your cell phones. If you've got an old cell phone which does not have the silent mode, put it in your car or leave it outside because we will not allow you to answer it. The restrooms are at the back. Please feel free to use this opportunity to go and relieve yourself because when the proceedings are underway, you will not be allowed to move unnecessarily in the hall. When the academic procession will be entering from the back of the hall, you'll be shown what's going to happen. You'll be requested to rise. A colleague of mine will step forward and indicate to you that please rise, the academic procession is entering the hall. You are also requested to remain standing all the way so that when the academic procession reaches the seat, you will be given an indication that you should settle down in your seats. In terms of COVID compliance, masks, wearing of masks is compulsory. You will not be allowed to enter the hall without your mask. Shaking of hands is also prohibited. You are not allowed to shake hands. And also make use of the sanitizers to sanitize your hands. We have two kinds of official photographers. The first one is Gordon Harris, who are the official university photographers. No other photographers will be taking pictures in the hall. Feel free to take photographs outside. The second official photographer is the communications and marketing colleagues who are here with us. They will also be allowed to take photographs inside the hall. Otherwise, you have a fabulous day. This is your day. Your kids, your wives, your friends are having their day. Please celebrate with us. Ululate, but do it within reason. If you ululate, don't walk in the corridors and disturb the proceedings. Ululate from where you are seated. We appreciate it, but don't overextend it. Otherwise, thank you very much. Have yourself a wonderful morning. Can I see whether you are still with us by giving us a thunderous round of applause, shall we? Thank you very much.
Morning, ladies and gentlemen. Welcome to your graduation session for the how manyth time? Thank you. Just in order to explain the procedure of taking photographs for you on stage, you need to bring a yellow card, bring it to stage. It'll be taken in on the way here. The second thing will be name ticket, which you also bring to the podium. You'll show that or hand that to your dean, but you need to take that back. Once you arrive here, you'll find that there's a carpet. Please stand on that carpet. That's the correct space for you to stand. Be mindful that there are two sets. The other one is on the other side, and the other set of cameras is on the far right-hand side, or right in front of you, this block far to the left-hand side, just in order to get that right. After you've done with the dean, you'll take your name card back. You'll proceed to the Vice-Chancellor's chair, where you'll be conferred, your qualification will be conferred on you, tapping on the head. Please do look the Vice-Chancellor in the eye. It just makes for good communication. And then lastly, you need to proceed to the banding box. You'll all move to the stage with your hoods on your shoulders already. You'll find another carpet, stand in the middle of that carpet, and then look to that camera where the flash goes on the far side. The registrar will stand behind you. You'll be part of the photograph, but there will be no touching, no drawing of hoods. Afterwards, then you'll move off the stage. You'll make a sharp right. Another photograph will be taken behind the stage, a head and shoulders portrait. If for any reason you've got something in your hands, please just drop your hands. It's just a head and shoulder photograph. And after that is done, you need to proceed to the tables where your qualifications will be given out, and then you can proceed back to your respective chairs. We do these photographs of each and every graduate. However, if you want to have this photograph sent to you or mailed to you, then you need to make an order, and you can do so once the ceremony is officially done outside on that top floor through that burglar doors. We are clearly marked, and you can also order family photographs there. Family photographs will be taken after the session has taken place in the squash courts to where I'm pointing now. You can make the order there, and then you can proceed downstairs. Thank you.
Good morning. The last set of instructions to the graduates. When you are graduating a bachelor's qualification, you kneel on the stool. But if it's a diploma or a certificate, you just pass. It's understandable, ne? Yes, and then you just pass and go to the registrar for photos. If it's a diploma or a certificate. And you can pull down your mask when you're here just for photos. Thank you. Apologies for bits and pieces of messages. This is for all that have previous qualifications. Today, you only have the hood that you're graduating, not other hoods when you come here. You can have the others when you take photos outside.
Ladies and gentlemen, the much-awaited moment has arrived. Please rise.
By virtue of the authority vested in me, I constitute this gathering as a lawful congregation of the Sefako Makgatho Health Sciences University. Please remain standing as we observe a moment of silence in lieu of prayer. Thank you very much. You may be seated.
Allow me to start off by welcoming all of you in this venue and those watching our ceremonies live through social media platforms to this momentous occasion. We have all been longing for these contact graduation ceremonies for a while now. After 2 academic years of virtual graduation ceremonies occasioned by COVID-19 pandemic, we are indeed grateful that the Supreme Being has made it possible for us to conduct the 2022 graduation ceremonies at a venue, a tradition that is central to the very existence of universities, including our own. Let me first welcome all the parents, guardians, friends, and family members of our graduates who have graced this contact graduation ceremony, the first of its kind since our last one in 2019. I would also like to welcome members of council. Members of the SRC leadership is with us and they are also welcomed. And let me particularly acknowledge the presence of the Deputy President, Ms. Yanga Ngese. I also want to take this opportunity to welcome President of Convocation, Mr. Linda Roji. Secondly, allow me to also welcome all the sponsors of our graduates who had found time and space to attend the contact graduation ceremonies. My colleagues, the academic employees of the university, and the support and administrative staff of the university, who have in various ways made it possible for the graduates to complete their studies and be with us today. They are also welcomed to today's event. A special word is on your shoulders as you are the visible ambassadors of the university in your workplaces and other professional pursuits. Lastly, it will be a remiss of me not to welcome our graduates. without whom this occasion will not have been possible. You have, through your resilience, curiosity, and dedication, achieved your various qualifications. The road was never smooth sailing for you. However, you have proven to be equal to the task. Hence, we are celebrating your achievements today. For the 3-day graduation ceremonies, that is from the 25th to 27th May 2022, the university will award higher certificates, postgraduate diplomas, and confer bachelor's, master's, and doctoral qualifications to over 1,440 candidates. Of this total number, approximately 185 honors, 150 masters, and 14 doctoral qualifications will be conferred at these ceremonies. This testifies that in spite of its size, the university continues to make a significant contribution to the human resource needs of our country. These achievements will not have been possible without the leadership of the Vice-Chancellor. I therefore wish to take advantage of this occasion to thank and welcome our beloved Vice-Chancellor, Professor Peter Mbati, who is presiding as Chancellor of the university today. Prof. Mbati, your tireless devotion, strong work ethics, professionalism, and unwavering dedication to turning this university into a premier institution of higher learning is very visible and palpable. Mr. Chancellor, all of us with eyes that see are beginning to see the green shoots of your hard work. All of us with ears are beginning to hear the footsteps of a changing SMU approaching and positive voices about the university. All of us with noses are beginning to smell a different aroma at SMU, a scent of an SMU that is beginning to make a total break with its ugly past. We are beginning to hear the academics who are gradually taking their rightful places in knowledge production and dissemination processes of the university. The very foundation upon which any successful university is anchored. Mr. Chancellor, may you and your management team be continuously endowed with strength, wisdom, and insights to turn this institution into a national asset it was established to be, focused solely on contributing to the national development imperatives of South Africa. With your results-driven leadership style, Mr. Chancellor, this institution is being placed in a unique position to contribute significantly to the greater good of our nation, Africa, and the world. With these few words, I welcome you all to today's graduation ceremony. Just relax and enjoy the ride with us as we celebrate the achievements of our graduates in a true SMU style. I thank you very much. Acting Chancellor, I have the honor to request you to award the certificates and the diplomas and confer the degrees on the candidates whose names appear in the program.
Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree Bachelor of Advanced Nursing Science. Keswa Nonsikelelo Precious. Kumalo Margaret Charlotte. Magabo Refilwe Naomi. Mogorosi Tebogo Pauline. Mukwevu Mushoni Elizabeth. Nyamaropa Temptation. Pasha Mankwane Charlotte. Peto Marcelena Caroline. Ramatsetse Tatu Tabita. Ram Mutla Mutlalo Daphne. Tilu Zikalele Kya Mokhetse. Gatle Debogo Hope Vanessa. Letswalo Diapu Lionel. Lipatsi Pumutsu. Magwai Mashaba Muriel. Masangu Nomshle. Mashao Rudzani Innocentia Abel. Congratulations. Acting Chancellor, by virtue of the authority, Acting Chancellor, I have the honor to request you to award the certificates and diplomas. So I'm actually reading the wrong one, I apologize. It's tension. Acting Chancellor, I have the honor to present the following graduates whose name appear in the program and have complied with the requirements of the degree, Bachelor of Dietetics. You are the first. No? Matibe Rapule Clearance. Mnisi Lucender Michel. More Bonello Coliswe Prudence. Mukari Kamugelo Puseletsu. Mulawutsi Marandela. Ndwandwe Mbalitzetsu Notandu. Ngwepe Wendy. Roji Guguletu Retio Aljoy. Mampa Tebogo. Sonny Akshay. Ngobeni Dunisani Cynthia. Acting Chancellor, I have the honor to present the following graduates whose name appear in the program and have complied with the requirements of the degree Bachelor of Nursing Sciences and Art. Chabalala Lekani. Katora Francisca. Chauke Boitumelo Dumisane. Chauke Rigoningu Precious. Khaditsi Manyeleng Desiree. Kuno Kiabetswe Anita. Liu Lesejo. Bopape Kuluane Isabel. Leshabane Rebotile Andrina. Lesufi Ramatabate Susan. Mainecha Machidishu Joyce. Mafane Hendrik Nalamotse Ramagatisha. Mashlangu Zanele Liena. Malula Mochete Khopisu. Kobe Mapeo Gertrude. Malema Dina Maikanya. Mawane Tulile Innocentia. Mashallah Uniken Leti. Mashangwanye Pride Sahwadi. Matebula Kutali Matimba. Matlala Poncho Muriel. Matlo Ben Rachabo. Matsamela Marta Disebo. Maupa Dibuleng Irene. Mkhiba Sizakele Jr. Modiba Leratu Merchel. Mogoba Cynthia Lebogang. Thank you. Okay. The sound is back. Mogolela Omfile Lucia. Mokwena Aoron. Molapo Boitumela Jacqueline. Mongao Ontiretse. Morodi Kagiso Sara. Mochweneng Refilwe Mama. Mpaslele Karabu Mavis. Ntomba Ntombi Fitu. Mulitsi Patuchetsu. Ndlovu Nonkuleleku Jane. Ndobe Chris. Ntsobela Tion. Nechi Tanini Mukove. Nkobeni Felicia Takisi. Nyangule Nantodokazi. Rakubela Gansi Alfred. Ramaglu Sewela Charlotte. Rampai Chepu. Sekole Mohadi. Shakwane Treasure Lutando. Shibambo Jabulani Sylvester. Tabila Puti Maria. Tefu Matete Sharon. Tolu Molebogeng Estelle de Grecius. Chechlan Yani, Boykutsu Clementine. Chikosi, Mashudu Ivani. Van Rooyen, Queen. Zundu, Linda Kushle Siabonga. Swane, Linda Kushle Tebangweni. Mabunda Annie. Muhabi Sophie. Radebe Lucia Pumelele. Similane Goodness. Okay. Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree Bachelor of Occupational Therapy. Dikobe Lesedi. Ibrahim Mohideen Asra. Howeni Tandiwe. Komola Simon. Letswalo Martha Boitumelo. Maki Lebogang Vanessa. Mabena Kanyisile Roxette. Makinta Tapelo Alpheus. Makola Kutso Mahale. Marutla Tabile Bonnie. Mashaba Sara Nakira. Mashangwane Kate Nkateko. Mohajane Botsang Shamrock. Mokwena Kamohelo Tatu. Mosla Monyane Tumisu Praise. Molutimile Leratu Bridget. Monkwe Nalana Tumelo. Motlonzi Lebogang Enika. Mutlane Abigail Mashwene. Moyeni Mpumelelo Mandisa. Ramatsia Tendu Precious. Ramutaga Maligana Yvonne. Senego Noko Michelle. Senego Noko Michelle. Van Huisteen Anlia. Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree Bachelor of Science in Physiotherapy. That's Baloyi Anita Masolo. Baloyi Nchovelo Evans. Chania Gita Harilo. Lamini Siabonga. Shlungwani Daphne. Kekana Oratile Magdalene. Ganyago Kwena. Koza Dalton. Koza Amina. Kwali Rorisang Rosa. Kola Joy Madimeta. Lekoleni Fortunate Tebogo. Lesulang Ntabiseng Ruth. Marke Calvin Motudi. Madiba Malamba. Makhacha Mainchi Mashoto. Machachane Mashlatse Lona. Maholo Chilfatsu Innocencia. Machotlo Rialubocha. Makwa Rudzani Lillian. Maloko Nelson Matthews. Maluleke Lebogang Francina. Mama Bolo Mogetwa Beauty. Manaka Manoko Maria. Mandiwane Goodness Ndidlingwane. Masangu Kwetsimane Sharon. Masamola Shilela. Mashablia Molamose Jackie. Masilela Ikaneng Hope. Matlo Solomon Mpotle. Matlaotsi Cholanong Precious. Matsane Nontobeka Desiree. Mbebe Bawinile Tracy. Mtlalose Letuku Tula. Nisi Mdeni, welcome. Modise Lazarus. Mogoru Rachwe Sebu Gloria. Moimi Maslaku Eva. Mokonyane Fumelo. Moloto Karabu Francis. Mostert François. Mukumeni Vulizani Charlotte. Ndobe Areta. Guveni Ntokoto Valenti. Nokeri Makwena Nkele. Shani Bonginkosi Fortress. Nchaveni Muefe Lia. Padu Kuketsu Delpha. Ralete Bontle Rejoice. Rasakanya Matumi Karel. Rothman Michaela. Skitter Annemieke. Hierso. Caesar Tuto, sorry. Shivambu Nkateku Wendy. Sibia Tandanani Gavin. Sitole Masibonge Zipo. Tisani Matsubane. Vilankulu Mixo Surprise. Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree Bachelor of Speech, Language Pathology and Audiology. Baloy Gladstone. Chauke, Charity Cholofelo. Jordan Anke. Mabosa Minyekelo. Mabena Musa Wenkosi Muzi. Mabusela Khomolemo Patience. Mapane Makatele Claudia. Makafola Terence. Maladimo Mashanem Lebocham. Mankhane Valentine Ntompefuti. Mantata Juagelo Josephina. Marima Nkari Ashley. Mariri Constantia. Mashaba Phila Lois. Matsitsa Deneo. Mketawa Rosemary Ndlovu. Finger Tabiso. Mkawanzi Lungile Hope Honey.
No, Kwanazi. I'm a speech therapist.
Okay.
Kwanazi.
Kwanazi.
Yeah, Kwanazi. Kwa? Say
Mkwa.
kwa?
Yes.
Aqua?
Aqua.
No. How to say
Yes.
aqua?
Yes.
Kwa?
Mkwa. Mkwa.
Mkwa?
Yes.
Nazi.
Nazi.
Yes, say it.
Perfect. Mkwa Nazi. Mochakane Liago Kevin. Mieza Mchlanchla Jeremiah. Mzunga Rendani Emmanuel. Nkosi Tembaletu Trevor. Piti Madikana. Poeng Remofilwe Clementine. Ramutaga Mutondi Dina. Rasing Betty Matlodi. Klu Zensley Pretty. Tselani Mochidisi Agnes. These are two dietetic students. So it's Bachelor of Science in Dietetics, which were awarded earlier. Mengwai Ramasele Zandile. Willis Amanda Mpumi. Bachelor of Nursing Science and Art, which was also earlier. Mabunda Cindy Zensley. Acting Chancellor, I have the honor to present the following graduates whose name appear in the program and have complied with the requirements of the postgraduate diploma in public health. Kekana Caroline Makutisha. Luvengu Chavungwe Vukwavu. Maomela Funanani. Mkasi Charles Javulani. Mpobole Nolutando. Mpongoma Vusumzi. Nsimeki Vukosi Richardson. Shikwambana Tulani Ngitletlani.
Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the higher certificate in vaccinology. Ntla Faith Hazivinei. Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree of Bachelor of Pharmacy.
Chabalala Katlego. Chasara Rumbizai Sharon. Chogwe Kuzo. Lamini Sizwe. Foot. Tendai Sibusiso. Tendai. Juma Shamila. Kekana Seti Mutlao. Khadiji Sibaba Likheto. Letsapa Hope Khumutsetsang. Letswalo Putana Diego. Mabaso Nomfundo Mbali. Mabatane Likhala Mahlatsi. Mama. Mabena Nozipho. Maditi Huzo Grace Kanyane. Makoro Dineo. Mahura Atlechang. Makubele Nico Cedric. Makuru Palisa Petunia. Malinga Malibongwe. Mulongwa Kiseilwe Winnie. Maseko Humutsu Amanda Temperance. Matonzi Tembani Hurricane. Matlala Pinyane Kujo. Maisela Mduduzi Theophilus. Melo Matilo Mildred. Nkiba Titswalo Messi. Mofokeng Lebohang Patience. Mohane Kabelo Kingsley. Mopatlane Hilda. Motsele Princess Lebogang. Mpelo Libeko Newo. Mtabeni Christabel Benelli. Mthembu Minenhle siyamthanda. Ngobeni Nthembo. Nkokhatse Mama Folo Patricia. Utsini Venon. Nukeri Venon. Papa Little. Piha Allen Matlomela. Ramuzuli Bukudo. Rapudi Mangwana Solomon. You did it. Richuri Anzani Fabian. Maungasini la. Maungasini. Manana Mpumelelo Zanemvula. Sibatana Riabetsi. Sibelebele Ramaite Sebele. Wow! Selapiana Tiketo. Selega William. Senyatsi, Leboya Kapela, Josephina. Seoka, Poppy, Godlive. Serache, Freddy, Vusimusi. Seshoka, Chanel, Mutsakai. Mungasili lana, angazi. Shazi Zamambombo. Shivambu Nico Derek. Sibia Londiwe Mambalan. Banigis. Sitole Dimpo Lucia. Skosana Janet Ntabeleng. Hi. Skosana Tandi. Hi. Van Wyk Nathan.
Before we start with the master students, I'm just going to request the award of two nursing students, undergraduate, that were not present at the previous round. So I'm going to ask them on stage. For Bachelor of Nursing, Science and Art, Ngobeni Felicia Tsakisi. Also for Bachelor of Nursing, Science and Art, Ngubane Balungile Zeketelo. Also for Nursing, Science and Art, Kutswayo Sandisiwe. Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree Master of Nursing. Matlo Sewela Ella.
Their names and supervisors.
Okay.
Nursing.
Yeah, it's the nursing ones. Yes.
So you should go to the name.
I just want to read the title of the previous candidate, The Knowledge, Attitude and Practices of Hospital Managers Regarding Records Management at a District Hospital in Gauteng. And the supervisors were Dr. Mokwena at SMU. And the next candidate is Junior Muzibudi. The title, Perceptions of Women Regarding Early Removal of Implanon NXT in Johannesburg Region E Clinics, Gauteng Province, South Africa, and she was supervised by Dr. Randa. The next candidate is Sadiki Chitamune. Title, Exploration of the Care of Mentally Ill Patients by Registered Nurses in the Emergency Unit at a Regional General Hospital in Tshwane, Gauteng Province. She was supervised by Dr. Chetty and co-supervised by Dr. Tobagale. The next candidate is Helen Ndobefuti Makane, and her project title was Experiences of University of Eswatini Student Nurses Regarding Community Care Nursing Practices in Manzini Region. Her supervisors were Dr. S.M. Maloko and Dr. Chetty. Virginia Sibongile Palweni had the title Perception of Nurse Managers Regarding Leadership as an Impetus to Patient Safety in an Academic Hospital in Tshwane District. Her supervisor was Dr. Malasela. Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied complied with the requirements of the degree Master of Public Health. Veronique Carmine Bailey worked on a project, Knowledge and Attitudes of Healthcare Workers on Pre-Exposure Prophylaxis for HIV Prevention in Sub-District 1 Tshwane, Gauteng Province. His supervisor was Prof. Matilda Mogatle. Tenyiku Violet Baloy investigated prevalence and factors contributing to unintended pregnancies, women assessing reproductive healthcare services, a selected public healthcare facility, Tshwane District, Gauteng Province. She was supervised by Dr. Al Fernandez and Dr. M. Ramopo. Shirley Davula studied utilization of employee wellness, a program by healthcare workers at Makudumagaza Municipal Hospitals in Limpopo Province. She was supervised by Prof. Chwele. Obey Titus Madzingo studied knowledge and practices of healthcare professionals regarding vaccine cold chain management in Chief Albert Lutuli Sub-District, Mpumalanga Province. He was supervised by Dr. N.M. Mogale. Matete Rinki Magamela studied the effects of stigma on the psychosocial well-being of adolescents living with HIV in Tshwane District, Gauteng. His study leader was Dr. Al Fernandez. Rebecca Chelani Macau investigated circumstances leading to home childbirths among women living in Winterveld, Tshwane North, Gauteng. His study leader was Ms. M. Ramopo. Ntombizotwa Wendy Makuzonke studied prevalence of factors associated with postnatal depression among mothers in primary health clinics within the Maseru City Council, Lesotho. His study supervisor was Prof. K. Mokwena. No, wait. Sorry. Amazia Makukule studied uncontrolled hypertension and contributing factors among chronic patients attending primary health care facilities in Johannesburg, South Africa. Her study was supervised by Prof. Mujaji.
The title is incorrectly spelled, so I just rewrote it for you a bit.
Okay. Katlego Sandra Mapetla. In a study, Barriers and Facilitators Influencing the Uptake and Acceptability of HIV Pre-Exposure Prophylaxis in Commercial Female Sex Workers in Tshwane, Gauteng Province, was supervised by Prof. M.M. Mogatle. Nozipo Allenpat Mpalala studied exploring the awareness, perceptions, and experiences of community members with the ward-based outreach teams in Dawn Park, Ekurhuleni Southern Sub-District. The supervisor was Mr. A. Klein Hans. Lucy Nomsa Masilela studied the nutritional knowledge and feeding practices of mothers and the status of infants in community health facilities of Mpumbela Sub-District in Mpumalanga Province. Her study leader was Professor Mujaji. Bitsy Winnie Modisane studied sexual behavior and condom use among high school students in a West Rand High School. Her supervisor was Dr. Fernandez. Ruth Kelebogile Mosia studied food safety and food handling practices of street vendors in Tshwane District. She was supervised by Professor Shalule. Marinki Maputi Nkwane, screening for anxiety and depression amongst HIV-positive patients at Chipang Wellness Clinic, Dr. George Mukari Academic Hospital in Tshwane District. She was supervised by Professor Kaimo Kwena. Samkelesiwe Nkumonde studied prevalence of depressive symptoms and associated factors among young men living in Gauteng, South Africa. She was supervised by Professor M.M. Mogatle. Matilda Malesu Ntlowana studied knowledge of lay councillors regarding the elimination of mother-to-child transmission program in Tshwane district. She was supervised by Dr. Al Fernandez. Bengikosi Javed Ntombela studied barriers and facilitators to accessing healthcare services by lesbian, gay, bisexual, transgender and intersex community in Ekurhuleni district. He was supervised by Professor M.M. Mogatle. Gopotso Shale Paladi studied prevalence and factors contributing towards children under 12 months old defaulting vaccinations in the expanded program for immunization in Johannesburg. She was supervised by Dr. Al Fernandez. Komogelo Teresa Bufolo studied substance use among university students in Maseru, Lesotho. She was supervised by Professor K. Mokwena. Nontsikelelo Kwebengu studied factors contributing to defaulting on expanded program on immunization vaccine amongst children 12 to 23 months in public health facilities in Solplaatje, local municipality, Francisbaard district, Northern Cape Province and South Africa. She was supervised by Dr. Al Fernandez. How are you? Raikani James Seretlu studied exploring the experiences and perceptions of primary healthcare nurses in providing sexual and reproductive health services for the LGBTRQ1 individuals in Tshwane, Gauteng province, South Africa. The supervisor was Professor Mogatle. Janke Tshwane studied self-management practices and associated factors in diabetic patients in Tshwane, South Africa. She was supervised by Professor Mujaji. Acting Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree Master of Science in Physiotherapy. Melinda Roux. The influence of gastrocnemius and soleus muscle function on functional gait in the acute and subacute phases of recovery post-stroke. A scoping review. She was supervised by Dr. Cochrane. Acting Chancellor, I have the honor to present the following graduates whose name appear in the program and have complied with the requirements of the degree Master of Science in Dietetics. Hello. Yes. Patience Oageng Legwale studied determining utilization of the Road to Health booklet to assess nutritional status of the children 6 to 60 months old in Mangaung Metropolitan Municipality Clinics, Free State Province. Her group supervisors were Ms. Connie Petla and Ms. Kaida McDougall.
Acting Vice Chancellor, I have the honor to present the following graduates whose names appear in the program and have complied with the requirements of the degree Master of Pharmacy. The first candidate is Tutor Christine Budin. She looked at the factors associated with human papillomavirus vaccination uptake by age-eligible girls attending public schools in the Sidiben district of Gauteng province in 2019. The supervisors were Prof. J.C. Meyer and Prof. R.J. Burnett. Tinotenda Vanessa Chidziwa looked at radiopharmaceutical inventory management at the Nuclear Medicine Department of Dr. George Mukari Academic Hospital. Supervisors, Ms. M. Lundy and Professor B. Summers. Dludlu Nolutando looked at radio labeling of peptide CDP4 with gallium-68 for tuberculosis imaging with positron emissions tomography. She was supervised by Ms. Lundy M, Dr. Amanda Mdlopana and Professor Summers. Devanisha Doraswamy looked at the review of surgical prophylaxis in cesarean sections at Freya Hospital, Eastern Cape, and her supervisor is Professor N. Shalak. Verna Ditoy looked at optimization of labeling of gallium-65 and ubiquicidin framinants with DOTS, NOTA, and ODAGA as bifunctional chelating agents. Her supervisors were Prof. B. Summers and Ms. Lundy Katz. Farisane Rosidiowo Mashudu. She looked at factors which contribute to the wastage of 18-fluorine fluorodeoxyglycose and interruption of services at the positron emission tomography computed tomography center at George Mokari Academic Hospital in Gauteng Province. She was supervised by Ms. Mareke Landi and Prof. B. Summers. Tasmia Gani, she looked at the impact of cultural barriers on effectiveness of oral antimicrobial administration by caregivers in the pediatric population. Supervisor is Prof. N. Shalak. Prudence Kabesile Ntombi Gwebu looked at the point prevalence survey of antimicrobial utilization at Relia Fitken Memorial Hospital in Manzini, Kingdom of Eswatini, using a web-based application. She was supervised by Prof. J.C. Meyer, Shelek Gordon, and Ms. Matebula Mien. Thank you. Elizabeth Wangari Itotia looked at the standard operating procedures and development of a procedure manual for a tertiary hospital positron emission tomography radiopharmacy. Her supervisors were Prof. B. Summers and Ms. Mareke Landi. Michael Kibika looked at radio labeling of CDP3 with gallium-68 for possible future application in tuberculosis and infection imaging using positron emission tomography. Her supervisors were Ms. Mareka Landi, Dr. Mdlopana, and Prof. B. Summers. Okay. Can't find you. Sorry. Heather N. Ellsworth McFarlane, sorry. Looked at the significance of risk factors associated with Clostridial difficile infections in 2 private hospitals, a retrospective study. Supervisor is Prof. Nshalak. Makwela, Atlanta, Democrat. She looked at antimicrobial management of skin and soft tissue infections in the surgical wards of a tertiary hospital in South Africa. Her supervisors were Ms. P. Skosana and Mr. W. Wandisile Grootboom. Masetla Mangwana Ami. She looked at antimicrobial stewardship for outpatients with chronic bone and joint infections in the orthopedic clinic of an academic tertiary hospital, supervised by Ms. Pumzile Skosana and Ms. P. Ntuli. Matseke Buang. She looked at phytochemical and pharmacological characterization of South African Mamodica balsamina limb fruit pulp. She was supervised by Prof. Mamza Mutibe and Mr. Mfumar. Shalanati Mbonani. He looked at the knowledge, attitudes, and practices of healthcare professionals on use of the stock visibility system for reporting medicine availability at the Umgungun Glovu Health District in KwaZulu-Natal. She was supervised by Mr. Ngengeli Sibanda and Dr. Mudiei Matlala. Theodora Ndombembongo Mdunge looked at attitudes and perceptions of pharmacy staff towards automated dispensing in 2 public sector hospitals in Gauteng, South Africa. She was supervised by Prof. Haneli Meyer and Dr. B. Stradom. Abaje Desalen Minda looked at establishment of quality manual for a single photon emission computed tomography radiopharmacy. Supervisors were Prof. B. Summers and Ms. Mareke Landi. Kotulo Relitile Sekhameti Moalusi. She looked at indirect costs of hemodialysis versus peritoneal dialysis from a patient's perspective for the management of end-stage renal disease at Dr. George Mukari Academic Hospital. Her supervisors were Dr. Mudiei Matlala and Mr. Ngengeli Sibanda. Tafadzwa Nathaniel Nzamhindu looked at cost and safety implications for the use of individual versus bulk fluorine fluorodioglykose patient doses in the positron emission tomography radiopharmacy at Dr. George Mukhari Academic Hospital. Supervisors were Prof. B. Summers and Ms. Mareke Landi. Gabazile Paula Lisishai Ngumalo looked at pharmacovigilance for antiretroviral and concomitant medicines at PDSOM 4 clinic in Harankwa Hospital. Supervisors were Dr. Mundie Matlala and Professor Robert Summers. Ntando yake Nkululeko Malo. He looked at antiretroviral treatment regimen adjustments in HIV-positive patients at Sepang Clinic. He was supervised by Dr. Elmin Bronkhorst, Professor Silente Bezwedinghot, and Professor Robert Summers. Elisma Peterson. She looked at the knowledge and perceptions of final year nursing students attending universities in Gauteng on antimicrobial resistance and antimicrobial stewardship. She was supervised by Dr. Deirdre Engler and Professor Silente Bezwedinghut. Rita Sakala, she looked at the regadinoson compared to other pharmacological stressors used in myocardial perfusion imaging at Department of Nuclear Medicine at the Tertiary Academic Hospital in Gauteng. She was supervised by Professor B. Summers, Ms. Mareke Landi, and Dr. P. Nemutanduni. Karina Fente. She looked at retrospective evaluation of the impact of pharmacists on patient care through therapeutic interventions in a private hospital group in South Africa, supervised by Professor Natalie Charlotte. Zikali looked at radio labeling and stability assessment of cathelicidin-derived peptides with gallium-68 as a prospective tuberculosis imaging agent. He was supervised by Mareke Landi and Dr. Amanda Mdlopana and Prof. B. Summers.
I beg your pardon, ladies and gentlemen. I have been advised by security that parents are engaging in a disruptive behavior. Parents want to leave the hall with their graduate. The proceedings are still underway. Please bear with us. We'll be finishing pretty soon. Don't leave because this disrupts our proceedings. Please bear with us. Stay, we'll be finishing pretty soon. Don't leave with your graduate because the proceedings are still underway. This disrupts the work of security. Please bear with us. Stay, we will be finishing pretty soon. Thank you.
Acting Chancellor, I have the honor to introduce to you Tizwilondi Ananias Makhatse,
Is that PhD?
who complied with the requirements of the degree Doctor of Philosophy in Nursing. The title of the thesis is Development of the Guidelines to Improve the Implementation of Infection Prevention and Control Measures in Public Hospitals in Gauteng Province. Okay, I think it's back. There. The supervisor. Yes. The supervisor of this study was Dr. Chetty and Dr. Nkwashu. As I understand, the supervisors are not, I'm not sure if Dr. Nkwashu is here. I'm going to read the section of the supervisors as well. The aim of Ananias Makhatse's PhD was to explore the factors that influence the implementation of infection prevention and control measures in specific public health hospitals in the Tshwane District, Gauteng Province. The research design used a mixed method approach. Three main themes emerged, namely the one, challenges regarding the knowledge and attitudes towards IPC measures, two, inadequate hospital infrastructure, and three, lack of management support were emerged from data analysis. This contributed into 7 sub-themes of as follows: 1, lack of knowledge; 2, support; 3, negative attitudes towards implementing IPC were identified among the nurses; 4, structural challenges; 5, lack of resources; and 6, lack of training. 7, poor communication was identified as a major hindrance in the implementation of IPC. The study concluded that nurses should be trained to gain knowledge in implementing the program through formal studies. This might be introducing the module for IPC in all higher education. Consistent support in terms of resources and good infrastructure maintenance is essential for improving the implementation of IPC in practical areas. Acting Chancellor, I have the honor to introduce to you Susan Masielu Mokone, who complied with the requirements of the degree Doctor of Philosophy in Dietetics. The title of the thesis is The Development of a South African-based Childhood Obesity Prevention Program for Children aged 2 to 5 years. And I'm going to give over to the supervisor, who was Dr. Manafe and co-supervised by Dr. Ngube.
Acting Chancellor, it's my honor to read the citation of Susan Mashilo Mukoni. Ms. Mukoni's PhD thesis titled The Development of a South African-based Childhood Obesity Prevention Program for Children aged 2 to 5 years. She used a randomized control trial with intervention groups and a control group. The study was conducted in phases: baseline, intervention, and post-intervention in 3 South African provinces, Gauteng, Northwest, and Limpopo. The baseline and the post-intervention phases assess the nutritional status of children, the nutritional knowledge, and food preparation practices of the mothers and caregivers in early childhood development centers. Baseline findings show the prevalence of obesity among children aged 2 to 5 years. In addition, mothers and ECD caregivers lack knowledge about healthy eating, which influence the provision of nutritious meals for the children. The 16-week intervention included nutrition education and physical activity sessions. The post-intervention findings showed changes in the children's body mass index. Regarding the nutritional knowledge, the long-term effect of the intervention is that giving nutrition education to mothers will bring about improvement in the provision of healthy diets for children and changes in the family food environment. Providing nutrition education to ECD caregivers and children is very important as it creates awareness about healthy eating. Preventing childhood obesity reduces healthcare costs and economic burden for the country, as it improves the quality of life by preventing chronic diseases that occur later in life. The increasing problem of overweight and obesity in South African preschool-age children has been widely reported and highlights the need for intervention in this age group. Providing nutrition education to caregivers of children in ECDs and physical activities showed positive effects on preventing overweight and obesity among children. This thesis has developed an obesity prevention program in a South African context based on the outcome of the baseline, intervention, and post-intervention data. The program development was in line with evidence-based and theory-based strategies to prevent and manage childhood obesity in ECDs. The developed program is hoped to underpin strategies to encourage the promotion of healthy eating in the homes and ECD centers and prevent obesity at an earlier age. The study findings are fundamental to informing policy and developing effective obesity prevention programs, especially for young children. Ms. Mukoni's research has been presented at national scientific meetings among peers, and a publication in an accredited journal resulted from the study. Acting Chancellor, I present to you Dr. Susan Mashilo Mukoni.
I hereby confer the degree Doctor of Philosophy by Keynote. Congratulations.
Acting Chancellor, I have the honor to introduce to you Mary Frances Chinwe Ome, who complied with the requirements of the degree Doctor of Philosophy in Dietetics. The title of the thesis is Development of Malnutrition Prevention Strategies for Infants and Children 0 to 24 months in Tshwane Health Sub-District 1 using positive deviance. The supervisors were Professor F.J. Feldman and Dr. Ngube. And I'm going to ask Dr. Manofe to present.
Acting Chancellor, I stand before you to read the citation of Chingwe Mary Francis Ome. Chingwe Mary Francis Ome, previously Engwelu, PhD thesis titled Development of Malnutrition Prevention Strategies for Infants and Children 0 to 24 months in Tshwane Health Sub-District 1 using a positive deviance approach, a sequential explanatory mixed method, quantitative and qualitative approach was used. A total of 270 infants and children with their mothers were sampled from the selected clinics. In the second phase of the study, 30 mothers who were involved in the first phase, quantitative of the study and agreed to take part in the focus group discussions were sampled. Among the infants and children in the study, 14.8% were either wasted or severely wasted. 23.7% were either underweight or severely underweight. 2.4% were either stunted or severely stunted. And 25.9% were either overweight or obese. Among the infants 0 to 6 months, 72.9% were exclusively breastfed. The employment status of the mothers was significantly associated with the maternal monthly income, weekly amount spent on food, and the weight of the child. Maternal monthly income was significantly associated with the weight and length of the children. Maternal education was significantly associated with monthly income and maternal knowledge with the practice of breastfeeding. The number of individuals in the household was significantly associated with the weight and length of the child. When comparing the three groups, the majority of healthy infants and children lived in a household with 5 persons, whereas overnourished infants lived in smaller households with 2 to 3 persons, and undernourished infants in households with 6 to 7 people. Weight for length, weight for age, and length for age significantly associated with the infant and child health status. In the healthy infants and children group, all mothers reported to have been encouraged by their sister, whereas in the overnourished, 42% and undernourished, 35% infants, the majority of mothers reported to be encouraged by clinic staff. Chronic illness in the mother also significantly affected the health status of the children. In general, the qualitative findings confirm that as a whole, mothers understood malnutrition and demonstrated knowledge concerning the consequences of malnutrition, and in particular, its associated medical and physical effects. The study confirms that mothers have knowledge of malnutrition, infant and child feeding practices, child care during meal times, as well as child care during illness. The study findings underline the need for nutrition education to enhance existing malnutrition prevention strategies. Mrs. Ome's research has produced an approved article for publication with an accredited journal. Acting Chancellor, I present to you Dr. Chingwe Mary Francis Ome.
Acting Chancellor, I have the honor to introduce to you Mabope Lindy Angeline, who complied with the requirements of the degree Doctor of Philosophy in Pharmacy. The title of the thesis is Student Outcomes, Development of a Support Program in a Problem-Based Learning Bachelor of Pharmacy Program. Her supervisors were Professor Hanneli Meyer and Professor Wim and Professor Beverly Summers. The supervisor will read the thesis.
Acting Chancellor, it gives me great pleasure today to read the citation for Lindy Angeline Zikalala Mabope. The title of her study was Student Outcomes, Development of a Support Program in a Problem-Based Learning Bachelor of Pharmacy Program. Her PhD study addressed concerns regarding the South African school leavers being underprepared for higher education, leading to attrition and low throughput rates, with graduates not adequately prepared for the world of practice. A mixed methods, explanatory and sequential study was used to develop a structured student program for the problem-based learning Bachelor of Pharmacy program at SMU. The framework for the program I'm sorry. The framework for the program is based on student input, process, output, and outcomes. Data included correlations between the selection process, the academic performance, and the pre-registration professional outcomes, with contributing factors explored. Evidently, success depends on cognitive and non-cognitive skills, with at-risk students identified, multifaceted factors that affect their academic performance, and a need for referral for assistance and/or support. Findings showed the necessity for a dedicated student support officer with structured and comprehensive, context-specific interventions tailored to address the unique needs of students and to collaborate with other referral units within the university. Furthermore, monitoring and evaluation of the program is paramount for accountability and ensuring that graduates produced are fit for purpose. The structured support model developed in this thesis makes a valuable contribution to pharmacy education at SMU and other higher education institutions in South Africa. Ultimately, student support is central as they are our human capital. Thank you. It gives me great honor to introduce to you Dr. Lindy Angeline Zikalala Mabope.
Graduates of 2021, this is your day. We applaud you, we honor you, and we stand with you during this momentous time. Today we recognize these accomplishments of you, the undergraduates, the graduates, and the doctoral students in the School of Healthcare Sciences and also pharmacy. So your dedicated pursuit and successful attainment of your respective degrees will allow you to make a difference in the health and well-being of our nation as future practitioners, educators, researchers, and even some of you, again, students. You have made it. You persevered through the years. There was COVID. You studied dutifully, spent countless hours at internships and clinicals and at clinical sites, put in many late nights and early mornings. You may have even balanced academics with both family and or work life in some instances. But you made it, and you are now sitting here representing the class of 2021. A simple definition of change is to become different. And during the past few years, you have made choices that will have a huge impact on your future. And you have changed. So your experiences at Sefako Magatho Health Sciences University have altered your perceptions about the world and about yourself. Your experiences will continue to be the lens in which you see the world. Many changes have occurred in your personal and academic life, and that's simply a part of life. Change will always be around the corner. It transcends you, builds you, and most of all, helps you grow. What makes SMU exceptional are the bonds that hold together one of the most diverse campuses in our nation. As a future health and human service professional, inclusion is something you will embrace wholeheartedly, as the ones you will go on to serve will come from all walks of life. Prepare yourselves to make a bold difference in your profession and in the lives of those you have chosen to serve. And as we reflect today, let's be reminded also of those who have been our rainbows in the clouds, those who have guided you along the way and supported you throughout your journey. This day also serves to honor them, family members, friends, and loved ones. To those who surround us in rainbows of love and friendship, we give you our highest gratitude. Graduate, you have been well equipped by your teachers, who are leaders, researchers, and who are recognized for excellence in teaching and research. Their dedication, hard work, and passion have guided you to this day. To the staff and administration of the School of Healthcare Sciences, we give you our highest gratitude. Graduate, we say thank you. As you go forth as members of Sefako Magatho Health Sciences University 2021 graduating list, and alums of the university, be proud of your individual and collective accomplishments. When you leave here today, you will represent the school and university as alumni will make a difference and truly impact our nation in critical ways. Know that you, your alma mater, and your departmental staff are so very proud of you. And perhaps more importantly, please know that we are all counting on you to help create a thriving, healthy nation, bringing to life the motto, Live Well South Africa. For the impactful distributions and the difference we know you will make in our nation and beyond, we also say thank you. Congratulations to each and every one of you.
Today I have the honor to congratulate a group of hardworking young individuals, dedicated, committed to ensuring that our patients have good outcomes, they have access to health. And for us to be able to do this today, it is because they had sponsors, they had God or their higher being first, and who then enabled their sponsors, their parents, their spouses to support them. And I would like to thank them. To the graduates, there are many opportunities awaiting you. I think we all appreciate that we have to adopt universal health coverage as a country. And this is to ensure that there's access to health for all. Therefore, opportunities are plenty for you, public health, pharmacy management graduates. There are policies to be developed, pharmacoeconomic analysis to be done, health technology assessments to be done, to make sure that there's access to health for all. Radio pharmacists, you are in a unique position that you are the only pharmacy cadre, or one of the two, that can actually register as specialists. So I implore you to go out there, collect your evidence, knock on the Pharmacy Council doors to say, here's my portfolio, I'm ready to be added to the list. Currently we only have 3. Opportunities plenty. Clinical pharmacists, pharmaceutical care, central to your duties. And one of the main things is to make sure that you have better patient outcomes. To pharmaceutics and pharmaceutical chemistry graduates, there are many plants that are indigenous to Africa that we have used over decades that have not really reached the market. The opportunities out there. There are many opportunities to develop new technologies to make access to health easy for all. Opportunities are out there. Be farmers, my good people. You've made it. I want to congratulate you for making it through COVID-19. It took us 2 years. But the one thing I'm proud about of you as a group is your dedication, your support for each other, and not leaving anyone behind. I'm proud to say 80% of the students who registered in this university as your group are here today, throughput 80. Congratulations, guys. So as you go out, remember, we always say you're ambassadors of this institution. We'll be judged by the West. And remember, whatever you do, we've instilled qualities that are required out there. Uphold them. Because whatever you do determines who comes here. Remember, whatever you do determines where you go next, your community service. Whatever you do determines whether you have the job after community service. So serve us well, serve the community well, do us proud. You know where you come from. Represent those qualities. And would not have done this without the support staff, academics. Today we are the smallest school, but we have the second largest master's output, 27. So it just shows the dedication we have, and there's still more coming. But it shows the dedication that academics have, the support staff have, and I would like to thank all, and congratulations, guys.
Acting Vice Chancellor Professor Mbati, Acting Chancellor Professor Mbati, Acting VC Prof. Dimana, members of Council, the Dean of the School of Pharmacy, Dr. Matlala, Acting Dean, and the Acting Dean of the School of Healthcare Sciences, Prof. Feldman, members of Senate, members of the Executive Management, members of Convocation and alumnus present, academics, staff, no singaye bethu. I greet you all in the wonderful mighty name of Jesus Christ. Amen. I don't know where to start and really what to say to you, because yesterday I was actually in your position, seated where you're sitting. And before I speak, I'll first sing a song. I thought of a revolutionary song because I'm like, man, sibancane, like we're young. But a revolutionary song, I feel like other people will be left out, but there's a song that I feel like all of us would relate to, eti. Om Sinti, Si, Om Sinti, Si, Nguwe Olithemba, Sithi Om Sinti, Si, Om Sinti, Om Sinti, Si, Om Sinti, Si, Nguwe Olithemba lamandla awethu. Thank you. Colleagues, the book of wisdom in the book of Ecclesiastes says, and I quote, "There is a time for everything, and a season for everything under the heavens. A time to be born, and a time to die. A time to plant, and a time to uproot. A time to kill, and a time to heal. A time to tear down, and a time to build. A time to weep, and a time to laugh. A time to mourn, and a time to dance." Close quote. Many of you, if not all, have gone through some challenging periods in this institution whilst trying to obtain these degrees. Though the experiences might be different, I have gone through those too myself. Though there were times where you felt like giving up, you chose to be resilient through it all. That is highly commendable and deserves a round of applause. Now it's time for you to move on to what's next. But you must not let anything deter you from taking those steps. What is important is to start. Don't spend too much time trying to choose the perfect opportunity, that you miss the right opportunity. Recognize that there will be failures and acknowledge that there will be obstacles. But you will learn from your mistakes and the mistakes of others. For there is little learning in success. Grab each and every opportunity with both hands, and in all that you do, don't forget to fly the SMU flag high. I'd also like to appreciate and congratulate the young women who are graduating today, acknowledging the current socio-economic status and where we come from as women. Today we remember Mama Albertina Sisulu, who was a nurse, an activist, and also one of the high-profile leaders of the anti-apartheid resistance in South Africa. Mama Sisulu has taught us to emulate our fearlessness, our tremendous strength, and our fortitude. Looking at the significant number of women graduating today versus that of men, I can confidently say that the struggle of women is in safe hands and it is advancing in the right direction. Now more than ever, I am confident that the likes of Mama Winnie Madikizela Mandela and Mama Charlotte Maxeke are looking down on us and are profusely proud of this generation of young women. Take up space and remember to always chin up before your crown slips. To parents or guardians, this is the work of your hands. These are the fruits you are reaping. Against all odds, you've supported your children. Congratulations to you too. To the academic staff, you have nurtured and groomed these young people. I have seen, while the graduates were walking on stage, I saw the academic staff of the Department of Physiotherapy Department, pharmacy, the acting dean of pharmacy. They were so happy as if they're celebrating their own children, which shows that, Professor Mbati, that we really have a certain caliber of academic staff in this institution, and we should always appreciate that. Mama Albertina Sisulu says, and I quote, "We are each required to walk our own road and stop, assess what we have learned and share it with others. It is only in this way that the next generation can learn from those who have walked before." Close quote. As you step into this new phase of your lives, there are many more who will come after you. You are a reflection of their hopes and aspirations. Lead and live by example. You are your wildest dreams. Graduates, allow me to wish you all the very best in your future endeavors. This is just the beginning. Amandla and Aluta continue.
Mr. Vice Chancellor, Prof. Mbati, Mr. Chancellor, Prof. Mbati, Acting Vice Chancellor, Prof. Daimana, members of council here today, the deans here with us, the members of the SRC, staff and parents. Most importantly, the 370 graduates from the School of Healthcare Sciences and School of Pharmacy. Ke batla ho apara ke taba dipuo tsa batho a di feliz ke le nna ka batla ho apara ke taba dipuo tsa batho a di feliz. Tate tekele. Thank you very much. Ka batla ko boya pharmacy le diet. I stand here this afternoon to congratulate you on behalf of alumni and convocants of this great university. Congratulations in obtaining your SMU qualification. At the end of this week, there will be an estimated number of 8,033 qualifications, SMU qualifications, across the globe since SMU was established. I deliberately articulate this figure to emphasize the exclusiveness of these SMU qualifications. Asimang lemang. So when you leave these gates, you will be asked continuously where you've obtained your qualification. So be proud and tell them it is an SMU qualification. 45 years ago, these walls were brought up, this campus was brought up. No one could have imagined that this place would turn into a dream-making faction, a theater of endless possibilities. No one could have imagined the SMU that we have here today. You will remember your very own experience when you got here. It's not the same SMU that you found. The SMU that you are leaving is far much more different than the one that you found when you got here. The campus has changed, the landscape, the attitudes, the culture has changed. You first arrived here very scared, but now you leave a graduate of this institution. It is evidently turning into a university that you have longed wished for. SMU is an institution where a young lady leaves the Eastern Cape with her suitcase, passes her grandmother's house in Soweto in Pimville to replenish her padkos, arrives in Pretoria, and a few years later returns back to the Eastern Cape, a healthcare professional to serve her community and her people. All 1,435 of our graduates that will graduate in this week's graduations arrived here with different backgrounds and experiences. Throughout your studies, you continue to face more challenges. But despite all those impediments, in this very theater, your dream of obtaining a qualification became a reality. I want to assure you that the many challenges that you face throughout your studies will not be reflected in your qualification. All of you leave here this afternoon as equals on a clean slate as graduates. Today proves that the material fiber of your beings is made from something of sought-not greatness. You are a great people. Continue to being great ambassadors of this great institution. Forever cherish her in your hearts. Remember to support her in every way that you can, so that she can be ready to receive your own children and grandchildren one day when they want to study and obtain qualifications. I now charge you, graduates, to return to the families and communities that have borrowed you to us. Serve our people with respect and dignity that they deserve. I officially welcome you into the ranks of alumni and convocants of this great university. And it is my humblest honor, Mr. Vice Chancellor, to welcome my very own blood sister, Kukuletu Rithio Hoji, as an alumni of this university. A university so dear to my heart. So with this example, I say to you graduates, it is now your duty to recruit your family members to study here. Right when they reach matric, when they look for a university, tell them, SMU, the dream-making factory is waiting for you. Above all things, I must then say, you guys are looking great. You are looking beautiful. If I was to take from Instagram and TikTok, I would say, I wish this can happen every 2 weeks or monthly.
Sana
We all rise to sing the national anthem. By virtue of the authority vested in me, I hereby dissolve this lawful congregation of the Sefako Mahato Health Sciences University.